the indigent, and that is those already not included in the first phase, and persons making voluntary contributions to the National Insurance Board. When all phases have been implemented, we expect that approximately 90 to 100,000 persons will receive direct benefit from the National Prescription Drug Plan. The second feature of the plan covers the diseases that will be covered in phase 1 of the plan. In selecting the diseases to be covered, we followed the recommendation of the Benefits Committee, which was established to prioritize diseases and specify the benefits package. The committee comprised of physicians and pharmacists from both the private and public sectors. In other words, the committee was not a political committee. It was a committee of healthcare professionals that advised the National Insurance Board of the diseases to cover in phase 1 of the plan. These diseases are arthritis, breast cancer, glaucoma, hypertension, major depression, psychosis, asthma, diabetes, high cholesterol, ischemic heart disease, and prostate cancer. The list of diseases will be reviewed periodically and amended to include new diseases or to exclude existing diseases determined from the results of the Benefits Review Committee. The third feature of the plan is that the drug plan will provide access to a defined list of prescription benefits. The Benefits Review Committee, of which I spoke about, established the criteria for inclusion of prescription drugs and medical supplies in the list of benefits. These criteria included the effectiveness, safety, approval for use in key developed countries, extent of local use, and cost. Panels of medical specialists who treated the listed diseases on a daily basis were asked to recommend drugs and medical supplies that meet the above criteria for inclusion in a drug plan formulary and to recommend the maximum dosage and supplies per month so that compliance behavior can be monitored. These recommendations led to the list of benefits of formulary comprising almost 160 drug items and medical supplies, such as diabetes tests, test strips, syringes, glucometers, nebulizers for asthma patients. I'm pleased to reveal to you, and we have these available, that our team, we have produced this book of the formulary and medical supplies that the National Prescription Drug Plan will be offering. And this book has already been provided to the healthcare professionals, and we're producing a similar book for patients, so that when a patient visits the doctor, the patient will be able to look at their disease to determine what is the medical drugs and medical supplies that the National Insurance Board is providing free. The objective, therefore, is to ensure that with consultation between the patient and the physician, that the physician will be able to ensure that he or she prescribes only drugs that are free to patients or provided by the plan, and in this way that patients will be able to ensure that they have lowered their costs of managing their chronic ailments.